The coronavirus pandemic is now nearly 2 years old, and in that time, we've seen multiple surges that haven't only impacted the way we live, but also the way hospitals have had to react.
And now, as it appears more and more people are ready to move on from the pandemic, Western Mass News reporter Hugh Zeitlin caught up with the president and CEO of Baystate Health to see exactly where we're at.
Everybody is beginning to see the light at the end of the tunnel.
With Western Mass on the downside of the recent Omicron wave, Baystate Health updated its non-COVID-19 visitor policy on Tuesday. The new guidelines allow for more than one visitor per day for non-intensive care patients and a second caregiver during normal visiting hours after a pregnant patient gives birth.
We also recognize the important role that family play, not only in emotional support, but also, just being there. We really regard them as kind of partners with us in helping their loved one get better.
At the peak of the Omicron wave, President and CEO of Baystate Health, Dr. Mark Kerouac, says they were caring for more than 300 patients with COVID-19. He also shared this graph showing each of the surges and just how hard Omicron hit about a month ago. Their number of COVID-19 patients has been cut by more than half over the last several weeks, with the state's Department of Public Health lifting most of its mask recommendations. And as communities prepare to respond to those guidelines, Western Mass News wanted to know, where are we in regards to the pandemic?
We're at the point now where nearly everybody has got some modest rate of protection. Not to say the virus still won't be circulating, but we've got about 65 to 70% of eligible people vaccinated in our area. And among those who aren't, I'm thinking a large number of them have actually been exposed to Omicron.
And while many seem to be ready to move on from the COVID-19 pandemic, could we see things move backwards down the line?
I don't think that the new strain will be attacking a population that's completely unprotected the way it happened back in the spring of 2020. So we're not going to see this sort of catastrophic pandemic spread, but rather little brush fires from time to time.
Hugh Zeitlin, Western Mass News.
And Dr. Kerouac also says with the new vaccine technology, they'll be able to custom tailor future COVID-19 vaccines for whatever strain of the virus is circulating.